Hello, welcome everyone to CASLPO's eForum. It is just about 12 o'clock, so we'll get going, and welcome to the eForum on virtual care standards. So we have some tips for you to begin with. We recommend that you close any other applications you have open at the moment. This seems to help maintain a stable audio and video connection. However, if your connection freezes, what we recommend is that you immediately exit GoToWebinar and return to the session straight away. It really does seem to help. The recording and the slides will be posted on the website, hopefully tomorrow. So just go on to CASLPO.com to events, and then in the menu on the left, you will see eForums web-based. So my name is Alex Carling. I'm the Director of Professional Practice and Quality Assurance here at CASLPO. And I'm very pleased today to introduce my co-presenters. Sarah.
Hello, everybody. My name is Sarah Chapman-Jay, and I am Advisor for Speech Language Pathology, Professional Practice and Quality Assurance. And over to Samida.
Hello, everybody. I'm Samida Joglekar, and I'm the Audiology Advisor and Manager of Mentorship.
Excellent, thank you. So we're going to be covering the virtual care standards today, and we're also going to be answering the questions that you have sent in. So thank you very much to those registrants who did send in questions. And then we want to make today as interactive as possible. So we've used scenarios to illustrate points. We've got a few polling questions, and we will be answering your questions today as well. So if you have any questions, please write them in the question box on your screen, and we will be monitoring the questions during the presentation. We will answer as many as we can at different sections of the presentation today. However, if there are some unanswered questions, they are saved, and we will send out questions either in the form of FAQs or we will respond to you personally. So we thought we'd start off today with some interesting background information that really illustrates how things have changed over the last year. We collect information in practice advice. So if you look at the first bullet, between March and September 2019, we had 23 questions about what would have been then the position statement on telepractice. But as you can see, from March to September 2020, we had 529 questions, which exemplifies the radical changes that our audiologists and speech language pathologists had to make to change their service model to virtual care. And you can see the breakdown there as well. Now, interestingly, the Practice Matters Committee, which is a committee of council, had already decided to review the position statement on telepractice, and they made that decision back in August of 2019. So the new standards for virtual care were developed with an advisory working group. So thank you to those audiologists and speech language pathologists who were part of the advisory working group. The committee and council then approved the standards for a stakeholder review. And following that review, the standards were published on the website on September the 3rd, 2020. So let's have a look at the virtual care definition. So obviously, as you know, formally telepractice. It is the provision of direct technology-enabled services to patients who are in a different location from the audiologist or SLP or supervised support personnel. Virtual care also includes the training and education of parents, partners, significant others, via technology, of course, for the direct benefit of the patient. And finally, it also includes technology-enabled instruction or consultation to your support personnel or to maybe other professionals who are directly interacting with the patient in real time. So what are the formats that make up virtual care? Well, we have synchronous, that is interacting with the patient in real time via various platforms. Asynchronous, which is interaction not occurring at the same time. Of course, we have the telephone, video, audio, maybe recordings, and written electronic formats such as emails and text messages. So looking at the standards, questions, and scenarios. There are 7 standards for virtual care, 2 for consent, 1 for security and confidentiality, then 2 regarding audiology and SLP services, and 2 for technology. So let's have a look at the first question we received. Can intervention be provided via different virtual care technologies? And can it be provided in combination with in-person services? And the answer is yes. It can include a combination of in-person and all different types of virtual care. Obviously, you're going to determine with your patient the most suitable intervention choices and be prepared to adapt those choices throughout the plan of care. And we're always asking you to be flexible and to keep the patient's best interests first. So, Sarah, maybe you could take us through the consent standards.
Thank you very much, Alex. Yes, so going straight into standard 1, audiologists and speech-language pathologists must obtain consent for services and outline the nature, benefits, risks, limitations, and alternatives specific to virtual care. Standard number 2 says audiologists and speech-language pathologists must obtain consent for the collection, use, disclosure, and retention of personal health information. And this comes from per HIPAA, the legislation in Ontario, when using virtual care platforms, products, and services. So we're going to go straight into our first scenario. This is Dimitri, and Dimitri has autism and needs speech-language pathology services. He was receiving treatment at the local Children's Treatment Centre prior to the pandemic lockdown in March 2020. In the interim, the CTC SLP services are now only providing virtual care. His parents did consent to SLP services, but they are not consenting to virtual care. So this takes us to our first poll where we like to get your participation. So let's think about this. What are the SLP's options? Are they number 1, tell the parents to find services elsewhere? Number 2, change your service model and provide in-person care? Or number 3, put Dimitri on the wait list for when in-person care resumes and discuss alternatives. So here is the poll. What are the SLP's options? And we would like you to select one of the following. And we'll give you some time to respond. And the poll has come in pretty high numbers on number 3 and 6% for change the model and provide services, and none saying tell the parents to find services elsewhere. So thank you very much. We will close the poll and we will return to the answer, which the majority, in fact, almost exclusively, everyone voted number 3. You would put Dimitri on the wait list for when in-person care resumes and discuss alternatives. So it seems that Dimitri's parents don't want to wait for in-person services. They do want to seek services elsewhere and start straight away, which is totally understandable. And so at the moment, they are still not consenting to virtual care. So what is the SLP's obligation to help them find alternate services? If we have a look at the professional misconduct regulation, it is actually considered an act of professional misconduct to discontinue services that are needed unless you do one or more of the following. Number 2, alternative services are arranged or reasonable attempts have been made to arrange alternative services. Number 3, the patient or client is given a reasonable opportunity to arrange alternative services. Number 4, restrictions in length or type of service are imposed by an agency. So when you are helping families to find alternate services, here's some things you can do. You can direct the patient and or the family to the public register, which is on CASLPO's website. It has a list of all the audiologists and speech pathologists who are registered in Ontario to provide services, as well as terms, limitations, and conditions, if there are any. You could also provide your own list of other companies, clinics, or professionals in the same geographical area for the ease for the patient and families. You can provide that list to them. You can also give information about the associations, OSLA, SAC, and CAA, as they also have a list of practitioners, and a couple of, maybe all of the associations also specify the area of practice they work in. So those are all avenues that you can explore to provide families with services. Regarding consent, if you need to learn more about the consent requirements for virtual care, we would lead you to our consent tool, which is on the CASLPO website. And this tool provides suggestions for both types of consent. So for virtual care, as well as personal health information regarding the collection, use, disclosure, and retention. So we're going to show you actually on the website. You would go into resources on our CASLPO website, then you would go into standards and resources, then you would go into consent and capacity. And you want to go to the very bottom of that list, and there you will find the consent tool. When you go into the consent tool, here's actually maybe the first picture of what it would look like. You select a setting, and you can see we have selected virtual care services. Then you would choose the type of consent you want suggestions for. So you might choose consent for services or collect, use, and disclose information. The lower arrow shows how you would hover your mouse over those areas. So if you want to find suggestions relating to service, you would hover over that first box. If you want to find out about the purpose, you would hover over that box, etc. So certainly take a look at the consent tool. It does now also include virtual care services. And it looks like this would be our first opportunity if there are any questions from the participants.
Hello, I would just like to make sure that you can hear me, Sarah and Alex.
Yes,
Yes.
we
Okay.
can.
Good. I realized that several attendees had some problems with audio, and I actually experienced a little difficulty with audio too, which is why I wanted to check. I hope that everybody's audio issues have been resolved now by logging out and logging back in, or maybe making some adjustments to your computer setting or headset setting. In terms of questions, we don't have any specific questions yet related to this. We have one comment that says, I would think you could explain that you're not able to do face-to-face, but other therapists may be working in person. I think both putting the child on the wait list and helping them to find an alternative services would be a good idea. And another comment is to direct parents to the Autism Ontario provider listing.
Absolutely. Yes, yes. So you're always going to recommend if there's any other programs or resources available to them in the interim also. That would be part of your role. Excellent, Samida.
Thank you.
All right, so I believe I'm going to take us now into standard number 3, which has to do with security and confidentiality. So standard number 3 is audiologists and SLPs must take all reasonable steps to ensure that personal health information, PHI, is transmitted, managed, and stored in a secure and confidential manner. So let's have a look at a scenario. Tahira is an SLP and works in a school board providing virtual care to students. The SLPs work in a large open concept office. They are provided with headsets and microphones, but they can still hear each other's conversations. So the question is, can Tahira work in a shared office space with other regulated health professionals where personal health information is frequently disclosed in this open environment? Is this allowed? And we are going to put this out as a polling question. So option number 1 is no, it is a breach of patient confidentiality. Number 2 is yes, all health professionals must adhere to PHIPA. Or number 3, not sure. So you should see the polling question and please make your selection. Okay, and we see the results here. The majority feel that it's number 2. And let's have a look at the answer. And the answer is, in fact, yes. Number 2, all health professionals must adhere to PHIPA legislation. So under PHIPA legislation, audiologists and SLPs cannot disclose personal health information that may be inadvertently heard. Confidentiality agreements should be in place. Many of you likely have these in place within your workplace already. And of course, in addition to that, you are going to take reasonable steps to safeguard personal health information. One possible way of doing this is to restrict access to office areas so that only the necessary people have access to papers, files, or even devices, computers that have personal health information. So let's continue with another scenario. Sam is an SLP who runs virtual social communication groups for patients with acquired brain injuries. Sam's partner and 3 kids are at home as well, and Sam is concerned about security and patient privacy. I'm sure many of us can relate to Sam's working conditions. Many of us are working from home nowadays, and we also have our families at home with us. So let's talk about the measures that Sam can take to promote security and confidentiality. So firstly, she can set up a private workspace in her home. If there are others at home, we know she has her partner and children, then she should do everything she can to make sure conversations cannot be overheard by them. The Information and Privacy Commissioner, or IPC, advises using work-issued computers and devices, which must not be shared with others. And Sam should, of course, use strong passwords and also encrypt any files or information on her work devices that should not be accessed by others. And she should not leave the device unattended or unsecured. So Sam has a few patients who are living in retirement homes, and she is concerned about her patients' privacy within the retirement home setting. So this is another polling question, and the question is it Sam's responsibility to maintain personal health information privacy within the retirement home setting? And the options are, yes, it is her responsibility as a regulated health professional. Sam is expected to make reasonable attempts to maintain PHI privacy where the patient is located. Number 2, unsure if Sam is responsible or not. And number 3, no, it is impossible for SAM to ensure PHI privacy in a different location. So this poll has now been launched, and you can go ahead and select your response. Okay, and we can see that 85% believe that it is SAM's responsibility. Some are unsure, some have said no. And let's have a look at the answer. And well done, the answer is number 1. As a regulated health professional, SAM is expected to take reasonable steps to maintain PHI privacy where her patient is located. So let's talk a little bit about what SAM can do to ensure security within the retirement home setting for her patient. So she can discuss the following options with the patient and with retirement home staff. These would include setting up a private workspace for the patient within the retirement home, discussing with the staff their confidentiality policy, ensuring that phone and video conversations that she has with her patients that involve personal or sensitive information cannot be overheard by others. She would need to discuss this with the staff as well. And advise the patient to not leave their own computing devices unattended or unsecured. So a lot of the things that Sam is doing for herself within her own home, she's also advising for the patient to do within their own setting. So we've linked some resources here for you from the Information and Privacy Commissioner. The IPC is also a great resource for you if you're looking for information on security and confidentiality of patient personal health information. You can also call them directly and ask them questions. And we've put some links to some nice fact sheets. Their fact sheets are short and written in accessible language. We have one on working from home during the COVID-19 pandemic, a second one on protecting your students' privacy online. That's an important one. And then a fact sheet on what is personal information. So let's move on to another scenario related to security and confidentiality standards. So Amal is an audiologist. He uses virtual care with patients in Ontario for validation of hearing aids, remote programming, and patient support. The technical and clinical information that he collects is stored in cloud, and Amal has concerns about security of patient personal health information that will be stored in the cloud. So what are Amal's responsibilities in terms of privacy and confidentiality with cloud storage? Well, he must take reasonable steps according to the practice standards to maintain privacy and security of the patient's personal health information that will be stored in the cloud. And this is going to be part of his consent conversation with the patient when he discusses with the patient that he will be collecting, using, retaining, or possibly disclosing their personal health information. He needs to explain to them that the information that he collects, some of it, or a part of it, or all of it, will be stored in the cloud. And the patient needs to give their consent. So we have linked another resource from the IPC called Thinking About Clouds, Privacy, Security, and Compliance Considerations for Ontario Public Sector Institutions. And you can have a look at that for further information. So Amal can also consult the following people at his workplace, for example. He can consult with an information and communication technology or privacy expert. He can consult with the cloud storage company directly to find out what their security features are. And he can consult with the hearing devices manufacturer, as their software may be involved in how patient information will be stored. When determining safeguards, Amal can consider the sensitivity and amount of information in the patient record. This information should be limited to only the salient information for the audiology care. He should also consider the number and nature of people that will have access to the information in the cloud. And he should consider any threats and risks associated with the way information is stored. When using mobile devices and cloud-based servers to access, store, or backup PHI, he should ensure that the PHI on the device or the cloud server has reasonable security protocols, and this might be part of the consultation and research that he will do on the cloud product. He's going to use strong access controls like multi-factor authentication and a VPN with end-to-end encryption. And of course, he's never going to use unsecured Wi-Fi when collecting, using, or disclosing or storing patients' personal health information. So let's have a look at another question we've received related to security and confidentiality. If my school board tells me that Google Classroom is the recommended platform for virtual care, is that adequate? Or do I have to further verify the privacy and security of the platform? Well, the answer to this question is, if you have any concerns about the virtual care platform that you are using or that you're being recommended to use, then the standards say that you must take steps to ensure that this platform meets security and privacy requirements. So this means you might have to do a bit of inquiry, a bit of research, and some consultation. You might need to consult with your IT department at work, with managers, with other colleagues who are using the platform. We did publish an FAQ earlier in the pandemic. It is on our COVID-19 webpage. And the second FAQ has to do with virtual care or telepractice. And it goes through various suggestions and advice on different steps you can take to ensure security and confidentiality of the platforms that you're using. Now, CASLPO does not recommend or endorse any virtual platforms, but our professional associations like AUSLA and SAC have provided information on virtual platforms for their members. So we would recommend that you have a look at what the professional associations have provided in terms of information. So that takes us to our second questions. Time to take questions.
Okay, thank you, Samida. And we do have questions coming in. You've addressed a few actually in the answers to the scenario, so that's helpful. So I'm going to bring this one up. How can we avoid mentioning any personal health information in a video conference with parents? I don't think we can avoid having anything inadvertently heard by families on other people's video sessions in your office space.
So sorry, Sarah, the question is not so much the worry of other regulated health professionals hearing a virtual session, because we are all have to comply with HIPAA and we're not allowed to disclose any inadvertently heard information. So am I right in thinking the question is somebody, an SLP or audiologist is having a session with a student and is concerned that the parents may overhear the information?
I think it might be if they're sharing an office space, say speech pathologists, and they're each working on a video session with a different set of parents, that they may accidentally, inadvertently hear other information. Now, I have one suggestion that maybe if you know, you have your own headset, even with noise cancelling, you are shutting off everybody else's information, and also to be very careful about, you know, not using a name. I mean, you can be providing recommendations, advice, treatment, but not using that person's name. So there may be some ways like that to, you know, limit the disclosure of any personal health information.
Absolutely, absolutely. And Sarah, I think we have time for one more question.
Okay.
If there is one.
Okay, there was a question about talking about storage of cloud information, does it need to be Canadian only?
Okay, that is very good. And I believe that the IPC does address this in their information about cloud storage information. Samida, is there anything else that you can add about this? I know IPC say it is preferable for the cloud storage to be in Canada, without a shadow of doubt. However, they are practical, and they do realize that in some situations that just might not be possible.
I was going to say the same thing, Alex, that I think they say it's preferable, but I don't think that it's a hard and fast rule that it has to be Canadian only, but they do have information, the IPC has information. So please have a look at their website on cloud storage, looking specifically for cloud storage guidance documents.
Excellent, thank you. And of course, if it wasn't a US cloud storage, a Canadian cloud storage, that's the time really to do your due diligence in finding about the security measures that the cloud storage company has. Okay, so we will continue now. And we are now going to move on to the standards regarding audiology and speech language pathology services. So you must continually assess whether virtual care is an appropriate service model based on the patient's unique needs, their unique environment, their technical abilities, and the equipment that they possess. Audiologists and speech pathologists must also have the knowledge and the skills to effectively integrate virtual practice into the patient's plan of care. Now, we have a number of scenarios here looking at different aspects of services, and we're going to start off with what to do in the case of an emergency. So, Victor has had a stroke. He lives at home alone and receives care from a personal support worker twice a day. Now, an SLP is providing virtual care for a swallowing disorder, but the SLP is concerned that Victor may choke, or indeed another emergency may occur. He is elderly, he has had a stroke, he is at higher risk. And the SLP is concerned that this might happen in the course of virtual care services. So what must the SLP do to manage a patient emergency? So first of all, have a risk management plan outlining how you will handle an emergency when providing virtual care. Each plan will differ according to the unique needs of the patient, and discuss this plan with the patient and maybe with relevant others, such as in Victor's case, a personal support worker, and outline the plan in the consent conversation. So, what might comprise a risk management plan? Well, you're going to be thinking about the risk of the tasks where applicable. Now, for dysphagia management, there are going to be some tasks that have greater inherent risk, and there are going to be other tasks that have less of a risk. So consider your risk level and what tasks you're going to be doing. Is there a support personnel or a helper who can assist the patient while you're doing the service, or can assist a patient in an emergency? Make sure you gather a good medical history and all the other significant information that might be required. See if there is some contact information for family members or caregivers who could be reliably contacted in an emergency. However, if you have to call 911, make sure in your risk management plan that you have Victor's location, his full name, his date of birth, all information that you would have to have anyway, but make sure it's accessible in case you need to call 911 and advise emergency medical professionals. Now let's go on to a completely different scenario and chat about Layla. Now, Layla is a student in school. She has a hearing deficit and a language deficit. So she receives both SLP and audiology services. Now, the school board employs communication disorders assistants, support personnel, who are supervised both by the audiologist and the SLP. And it's important to note that Layla's parents have consented to the CDA's clinical involvement. So can CDAs carry out virtual care with students? The answer is yes. Support personnel under supervision can carry out speech, language, and hearing therapy programs with students virtually. But it is your responsibility as the regulated health professional to ensure that support personnel have the required competencies, not only to deliver the plan of care, but for the technology required to provide that plan virtually. If the support personnel do not have the competencies, further training may need to be considered. So, are there any differences with the supervision when providing virtual care? Actually, no. The speech pathologist and audiologist, you're going to use different methods of supervision as appropriate. Now, all support personnel do need to be directly observed, providing patient intervention and on a regular basis, however, not necessarily with every patient or every student. And actually, virtual care can make this observation easier because it can be done in person or via a secure live video or a video recording as close to the therapy session as possible. Now, the amount and the method of ongoing support supervision will depend on the following. Obviously, the complexity of the patient. Here, Layla has two disorders that are being addressed. The complexity of the issues and concerns, always thinking about the risk and the risk of harm associated with the tasks that the CDA is performing. The competency of support personnel, we've talked about that, but also really consider the experience and level of comfort of support personnel and of you, the SLP or audiologist, of supervision of support personnel in the environment of virtual care. So, Sarah, if you could take us through the next scenario.
Thank you very much, Alex. Yes, so now we have Jasleen, a speech pathologist. She has her own private practice providing service to adults. And currently she's actually doing a mixture of in-person and virtual care intervention. So Jasleen has researched publisher websites to see if there are virtual versions of some of the standardized language assessments she likes to use and chooses to use. So the standardized test she uses most frequently does not have a virtual version, but there are no specific publishers' restrictions on their website or in the manual that she has. So it is time for another poll. Our question is, can Jasleen use the test when assessing patients via virtual care? They're pretty quick answers here. 1 is yes, number 2 is no, number 3 is it depends. Thank you, Alex, for opening up the poll. And we will give you some time. Okay. So now this is an interesting one because we have a combination of responses. This is up for discussion. So 34% say yes, 6% say no, and 60% say it depends. So let's take a look at the answer, and the answer is actually it depends. Jasleen must use her clinical reasoning regarding the interpretation of the test results and the use of standardized scores. So if we take a look at the Records Regulation 2015, for all assessments, the Records Reg requires you to document the following: the nature and results of each assessment. And as you know, this can be a combination of formal and informal testing. So obviously, because of maybe questions about the validity of some of the test items you did, you are also going to be supplementing and adapting your assessment to also combine it with informal testing. You're going to document the clinical findings, any recommendations made to the patient. You're also going to document what type of professional contact took place. Was it in person? Was it telephone? Was it virtual platform, or some other way? And of course, you're always going to be deciding what you need to document if there's any additional relevant factors. So carrying on with the same scenario, Jasleen, she's completed her assessment, reported her finding of billing the patient. So another question for you, does Jasleen need to include virtual service on her invoice? The options are no, she never adds in-person service on the other invoices. Yes, because that describes the services provided. Or 3, no, she is apprehensive the insurance company won't reimburse the patient for virtual care. Okay, so we have the poll is open. We want you to select one of these 3 options. Okay, so the results have come in. We have 20% for no, doesn't add in person, 79% yes, it describes the service provided, and 1% no, the insurance company may not reimburse. So thank you for those responses. The majority actually have selected number 2, yes, because that describes the services provided. So we're going to explain a bit about why this is important when you're doing your billing. The Professional Misconduct Regulation does state that submitting an account or charge for services that the member knows is false or misleading is an act of professional misconduct. The Code of Ethics also reminds us that as audiologists and speech-language pathologists, we shall be honorable and truthful in all professional relations. And the third point here is that insurance companies and other funders who are third-party payers for many patients expect this information to be included on the invoice. And so in addition to this, we want to know what type of insurance does Jasleen need if she's offering virtual and in-person care. So what she does need, certainly from CASLPO's perspective, is she does have to have professional liability insurance in accordance with CASLPO's bylaw number 6, and that is $2 million per claim for every employment setting. The college does not require extra insurance for virtual care. The provision of virtual care has been well established as a mode of service provided by audiologists and speech-language pathologists. But Jasleen can also consider the following. There could be requirements by the employer or contractor on additional types of insurance. Jasleen also has the choice to explore additional insurance, maybe cybersecurity, or special insurance for virtual care. She can also reach out to the associations because they do provide access to and preferred rates to insurance companies. And it looks like we're at another point for questions. So Samida.
Yes, we have a few questions. So related to insurance, there's one question that is it our or the patient's responsibility to check with insurers before offering virtual care?
That would be the patient's responsibility. It is their insurance company, often through their workplace, so it would be their responsibility. As very dedicated professionals, we always want to work with our patients and families, but really your responsibility really ends at providing the invoice. The patient, the family have to pay that invoice. How they get reimbursed is really up to them. But I know very caring and dedicated professionals and always thinking of the best ways to support families.
Thank you. If we have time for a couple more, maybe one more or two more.
Yeah.
So we have someone asking that describing that the service is virtual care provided by a CDA, is this required as well? Is it important that the invoice not mislead that the SLP was in attendance supervising if they were not in attendance during that specific session?
Absolutely. Yes.
Okay.
Sarah, I think you would agree.
Yeah, the invoice would reflect what services, who provided the services.
So actually what Sarah was talking about the professional misconduct regulation, it's false or misleading. And that's the important word. You cannot mislead. I think, Samida, we'll carry on. We have another opportunity for questions very shortly. So
Sure.
I am just going to.
Okay, so I'm going to take us through these next set of slides. So let's talk about an important question that we've received, and this is still related to audiology and speech-language pathology services. So the question is, my patient had a stroke last year and attends our aphasia conversation group. He is going to Florida for a month, and he is eager to continue with the group. As he is a resident of Ontario, can he still attend the group virtually? I know that many people are curious to know the answer to this question. So let's talk about the answer to can he still attend the group virtually? So the answer is that registrants, that is SLPs and audiologists, who are providing virtual care to patients outside Ontario must comply with any jurisdictional licensing requirements and standards. So what this means is that you, as the SLP and audiologist providing that virtual care, need to contact the regulatory authority, it might be another college or a state board, in the location the patient will be temporarily residing. Explain to them the situation, the type of virtual care that you would like to provide, and ask them if you can provide those services. And follow their registration requirements and standards if they have any. So you can provide SLP and audiology services to patients outside of the province, but only if there are no jurisdictional licensing requirements. If there are, then you must follow those. I hope that that helps to provide some clarity to that question. Now, to help you find some of this information a bit more easily, we've linked some resources here for you. So SAC have all of the colleges across Canada, their information listed in one place for you. ASHA has information on state-by-state telepractice and license policies in the US. And then we've also put a link for audiology and SLP associations outside of the United States. So hopefully these resources will help you locate that information a bit more easily if it becomes applicable in your practice. So let's move on to the technology standards for virtual care. And these are standards 6 and 7. So standard 6 is audiologists and SLPs must obtain and apply the technical knowledge and skill to select and use the most effective and secure technologies for virtual care. And standard 7 is audiologists and SLPs must take reasonable steps to ensure that any equipment used in the provision of virtual care for clinical assessments, measurements, and interpretation of results is adequate and reliable. So let's address a question that has come from audiologists. And this question is, under what circumstances can an audiologist conduct a remote hearing assessment? So the answer to this question is it really depends. We did try to answer this question in a previous e-forum that we did back in June on audiology practice in a pandemic. So for the audiologists watching, please look at slides 49 and 50 from that previous e-forum because the answer is there for you. But let's spend some time talking about this. Part of the answer that is important to know is that doing a remote hearing assessment at this time is a deviation from the practice standards for hearing assessment for audiologists. So that is an important thing to know. This means that if you are going to do a remote hearing assessment, because it's a deviation from the standards, you need to make several considerations. And some of those considerations would include, is this the very first assessment that you're doing with a brand new patient? Or is this a repeat assessment for a patient who you already know, and you're using the virtual assessment to check if their hearing is stable or if it's changed in some way? What are the patient characteristics? What do you know from their case history? Do they have any medical issues? Do they have any issues with vision or comprehension? Are they going to need any support during a remote hearing assessment? Are they going to be able to use the virtual technologies or products that you've selected to use? So thinking of all of these things, then is a virtual hearing assessment going to be appropriate for that particular patient? Virtual care standard number 4 talks about appropriateness, that we must continually assess whether virtual care is an appropriate mode of service or a service delivery model based on the patient's unique needs. Another important consideration is, are there any risks to this particular patient of doing a remote hearing assessment? If you won't be able to conduct otoscopy or do bone conduction thresholds or speech testing, for that patient, is there any risk with not being able to carry out these things? And then finally, having considered all of these variables, is it in the patient's best interest to do the remote hearing assessment? So these are all important things to consider. If you decide that a remote hearing assessment is going to be possible, feasible, or something that you can attempt for that particular patient, then you need to have clear clinical reasoning and a rationale for that decision, and you need to document it. And today we're talking about the virtual care standards. So of course, you're going to ensure that you meet the standards for virtual care if you're doing a remote hearing assessment. From standard 6, it means you're going to ensure that you have the technical knowledge and skill to select the most effective technologies. And standard 7, you're going to take reasonable steps to ensure that any equipment that you use is going to generate adequate and reliable results. So I would like to thank the audiologists very much who are raising this question. It is an important question, and it really is useful for us to know that this is a question that you have in your practice, and we need to know what's happening in the field of audiology. So thank you for this question. I'm excited to share with you that we are currently revising and updating the standards for hearing assessment by audiologists, and virtual hearing assessment will be a big consideration in the revision. We will be recruiting an advisory working group for this. So if you are an audiologist watching today and you are interested in participating in this advisory working group, please get in touch with us. You can contact me directly, or you can even right now put your name in the questions box, and then we'll know that you're interested and we can contact you. So thank you again for that. Let's move on to another question we've received related to technology. And that is, how and where do I obtain sufficient training on platforms, equipment, and materials to work effectively in virtual care? So the answer to this is there are many resources out there that we have access to, that you can access to become trained and to develop your skills. We've talked about the resources that our professional associations have provided. They all have training information on virtual care and webinars for their members. You can reach out to leaders in the field, to your colleagues who have been doing virtual care and using particular products or platforms. Talk to them about what has been working, what hasn't worked. You can develop or join special interest groups. There are lots of online courses and blogs. And of course, practice, practice, practice. Whenever we get involved in a new area of practice, we ourselves have to practice what we're doing. Practice using the platform, the product, the new piece of equipment, so that when we actually work with the patient, we will know what to do and how to use that product effectively. So practicing yourself is, of course, a great way to self-train and develop those skills.
Thank you, Sumida. So we are going, Sumida, I've come on one slide too early. Do you want to take everyone through this?
That's fine, yes, and we've linked the resources for you here again from our professional associations. So OSLA has their telepractice resources. Speech Audiology Canada has a webinar series, and they also have a nice document on dysphagia management via telepractice, which Alex referred to in one of the scenarios earlier, a patient with dysphagia. And then the Canadian Academy of Audiology have webinars as well, and a resource on improving hearing accessibility during virtual meetings.
Thank you.
Over to you, Alex.
So our final question for today, and this concerns quality assurance and the self-assessment tool. So we know that many of you have been participating in numerous hours of self-directed training for virtual learning. You've watched videos, you've explored platforms, and you've been practicing. So can you include this in your continuing education credits, or as we call them, our CLACs, continuing learning activity credits? And the answer is yes. You can go on to your SAT anytime. You can go on all this month and add, delete, or alter one of your learning goals to reflect and to be able to capture the new learning that has taken place with regard to virtual care. You can obtain CLACs for any new learning, such as researching platforms, researching products, attending e-forums such as today. Definitely put in an hour's CLAC for today. Any webinars, any reading, any long online training, etc. We are asking you to use your discretion, however, in the hours you devote to practice. Decide if it is real learning or if it is just practice. If it's learning, add the hours. But we're not looking for you to be adding hundreds and hundreds of hours. So we have come to the end of our presentation today. And I know we have 2 minutes, so I am going to ask Sarah if there is one question that we maybe could answer.
Absolutely. Firstly, I just want to say thank you, because there are a couple of audiologists who've already volunteered and said they're interested in being part of the AWG. So that's lovely to hear. So the question is, will SAC or another group be promoting greater ease of cross-provincial virtual care therapy? For example, patients who live across a provincial border, such as Ottawa and Gatineau in Quebec.
Excellent, thank you. And Sarah and Samida, this is a question we've received quite a lot, haven't we? And the answer is that yes, CASLPO is heading up the communications with other provinces to see if we can develop some sort of agreement. Now, I know with regard to Quebec, they have been very generous with French-speaking SLPs residing in Ottawa, and they have allowed a form of membership in l'Ordre to allow these French-speaking SLPs and audiologists to provide service in Quebec. But however, we're not resting there. We're looking at other provinces. And of course, with the pandemic, all of the other provinces are aware of this situation. I'm sure they're receiving questions just as much as we are. But please rest assured, we are heading up this project to come up with some interprovincial agreement.
So speech pathologists and audiologists should contact the Quebec regulatory body if they are in this situation.
Yes,
Excellent.
if they're on the border of
yes.
Ontario and Quebec. Yes, thank you. So I would just like to remind you that Sarah, Samida and I, with our colleagues, Sandra Corte and David Beattie, we make up the practice advice team. We have our web page. So we've added a link to our web page. Please contact us anytime you have a question about any regulatory issue. And we'd just like to end up with other ways you can contact the college through Facebook, through YouTube, and of course through our website. So Sarah and Samida, do you have anything else you would just like to say before we end this e-forum?
Just to thank all the, yes, thank you for joining us. Thank you for your questions. Thank you to the audiologists who volunteered for the AWG. And yeah, thank you.
And also, you know, we have been overwhelmed with questions. We know we can never always answer them all during this webinar. So we will be responding to any that we have not managed during this time.
Excellent. And thank you very, very much for joining. And we will now be leaving the webinar.